I ask my patients to do really hard things all the time. And so I actually vet who I accept as a patient, because if you want to have an exceptional outcome and not be part of the bell curve of expected progression or your risk of recurrence, if you don't want to be in those statistics, then you do have to transform. And as you know, healing is transformation. And so I vet my patients because I tell them I'm going to ask you to do hard things. I'm going to ask you to engage in self-reflection and self-inquiry. I'm going to ask you to change your lifestyle and your diet and maybe some of your relationships and habits. And so if someone is resistant to that, I say, think about it. Maybe you'll come back later. And some people do, you know? And so I accept certain people into my practice whom I feel are a good fit for what I'm going to ask of them. And therefore, I have a lot of successful cases, but you have to really understand what it takes, what it really takes.
And it takes an all-in mentality, as we were talking about, and our mutual friend Stacy has that all-in mentality. You put together the resource of the integrativecanceranswers.com. You have a lot of information there, but do you have any ideas on how to, like, for someone that is listening and says, well, I can't afford Dr. Nalini, what do I do? What are my options?
There are so many things you can do even if you don't have a lot of money. Anybody can eat healthy, fresh food, right? Anybody can exercise, get enough sleep. What are the basics? Like, what causes health is really the core question. And that applies to many chronic illnesses, not just cancer. But, you can set up your life so you walk through each room in your house and see what kind of cleaning supplies you have or body care products you have, and are they toxic? And should you be putting those things on your skin or inhaling them? And so you can walk through your house and start in your kitchen, in your bathroom, in your bedroom, in your garden, in your laundry room, and have your environment not have toxic chemicals in it. You can start there. And so it's just a learning process. I love the website Environmental Working Group, EWG.org, because it's a place to learn if you're not aware of where toxic chemicals come from, and you're looking for a sunscreen for your kid, so you can go on that site and find one that isn't toxic, right? And you're looking for a new shampoo for yourself so that you don't have one filled with chemicals that are carcinogenic like parabens. And so that's a great site if you're beginning to learn about all of this. And you can learn about which foods tend to harbor pesticides and insecticides more than others, and you can find out where you can shop at a farmer's market or where's there a store where you can get clean food, and really learn about how to feed yourself. And it's really simple. In my book, 32 Ways to Outsmart Cancer, that's what I have. I have 32 tips that are simple, that anybody can do, right? That anybody can do. Getting sleep is crucial to immunity, just crucial. And we're a culture that is so neurotic about being proud that you only need 4 hours of sleep, which is everyone needs 7 to 9 hours of sleep to have a healthy immune system and a healthy brain. And so anybody can do that. Anybody can get 30 minutes of exercise every day. You just have to walk. You don't need to be macho, And so these lifestyle changes actually have more impact than any drug. So anybody can do that. And then you can learn, like, what are the anti-cancer superfoods so that you eat those every day. So think about the garlic and onion family. Think about the broccoli and cabbage family. Those foods have phytochemicals in them that are potent in interrupting cancer development at every stage of development. You can just fill your diet with a rainbow of colors because each one of those plant pigments actually is a phytochemical that turns genes on and off. So that's why it matters what you eat, because you can turn genes on that suppress cancer and turn genes off that promote cancer by what you eat, by if you sleep, by managing your peace of mind and your stress. You can learn self-regulation. And so anybody can do those things. Absolutely anybody.
I agree. And again, they can go order, book. These are small investments you can make that then give you this foundation and resources. Learn to meditate or other, connect with nature, earth, all of these techniques that just take our own body and a just different mindset. There's so much conflicting information out there. What is your latest Outsmart Cancer diet, or is it one? Does it vary?
If we understand the physiology of cancer cells, then we can also leverage what's unique about cancer cells and change the diet to starve those cancer cells and stress the cancer cells and promote the healthy cells to be robust. So cancer cells are uniquely dependent on sugar. And so a lot of people think sugar drives cancer, but it's actually insulin that drives cancer. So every time you eat a carbohydrate, whether that's a sweet, a fruit, a sugar, a grain, a bread, a pasta, anytime you eat a carbohydrate, the hormone insulin is triggered because insulin's job is to take the blood sugar and open the door of the cell so the sugar could go inside the cell and be used for fuel and energy. So cancer cells have more receptors on their surface, and certain cancers are more sensitive to sugar and insulin than others, like breast cancer, pancreatic cancer, brain cancer, are exquisitely sensitive to insulin and blood sugar. So if you eat a diet that keeps your blood sugar and your insulin in the lowest quarter of normal, say between 70 and 80, that is a way to stress tumor cells. So let's say you went through cancer treatment and you were told you have no evidence of disease, you're in remission. But what we know after treatment is there are microscopic cells left, and there are some stem cells, cancer stem cells left. And so where oncology fails is they fail to tell the patient that because they don't know what to do about it. Right? And so cancer patients leave treatment and sort of everybody's hoping they're not going to have a recurrence. But almost everyone is at risk for recurrence because of these microscopic cells. So if you create a body where cancer cannot thrive, then those cells aren't going to do anything. And so you need to change the environment of those cells. So diet is a potent way to do that. Avoiding toxic carcinogenic chemicals is a way to do that. So by eating the rainbow, which we just mentioned, you're getting a multiplicity of phytochemicals which change the signals.
And that's like green broccoli, red peppers, blueberries. Is that what you're talking about?
Color. Lots of color.
Oranges,
carrots,
lemons.
Right. And just eat color.
Oh, no, not fruit.
Well, it depends on the patient. Like if someone has a sugar-dependent, insulin-dependent type of cancer, but they have a low tumor burden or they are very thin, they don't have diabetes risk in their family, there's wiggle room. So I'll say limit your fruit to a cup of organic berries a day. And you think about the sweetness on your tongue, and that'll tell you how glycemic or how sugary a food is. It's not rocket science, you don't need to measure it. If you put a banana on your tongue, it is a lot more sweet than putting a blueberry on your tongue or putting an avocado on your tongue. So you can tell about how food's going to affect your blood sugar by tasting it, right? So our bodies are such reliable feedback mechanisms, but we have to listen, right? We're so disconnected. And so listening to your body is part of having health, right? You need to know if you're hungry, if you're thirsty, if you're tired, right?
If you get a headache after eating certain foods.
Right, exactly. So we do like to eat a low-carb diet, and there's an enormous amount of research on low-carbohydrate diets combined with intermittent fasting being profoundly powerful in reducing recurrence.
Have you seen or are you aware, so my friend just went through chemo and all the things, and as well as herbs and supplements and some lifestyle changes to heal colorectal stage 4 cancer. No evidence of disease. And then recently had a seizure, and now she has lesions on her brain. I don't know quite the extent of that. But another friend had a different cancer that came back as a different cancer. Is there a chance that the new cancer is a result of the chemo, the treatment?
Yes. So what's true is if you have aggressive treatment like chemotherapy, some of the cancer cells are so smart that they figure out how to survive, and we call those chemo-resistant cells. So, you'll get a scan or look at your tumor markers as you go through treatment, and your oncologist might tell you, you're in remission. But in fact, there are these resistant cells. Anytime you have an aggressive therapy, cancer cells are really smart, which makes it difficult to treat. But also, if you're diagnosed with a lot of tumor burden, then you actually don't have one kind of cancer cell. You have a really diverse population of tumor cells, and so that makes it complicated to treat also, which is why if you have chemo, you get a cocktail of more than one agent to try and hit those different types of cells. But that's also why it's useful to include herbal medicines, specific supplements, so that we fill in the gaps. Like oncologists, because their toolbox is so toxic, they could do a little something, But we can, if we think about a wheel with many spokes and all the complexity and all the factors, then we could fill in the gaps on that wheel of what the oncologist isn't doing, like managing your blood sugar, managing inflammation, optimizing your vitamin D, making sure you don't have excess copper, etc. Right?
Thank you for listening to the Heal Podcast. Be sure to tune in for more empowering wisdom and inspiring healing stories. Oh, and make sure you hit the follow button on Apple, Spotify, or wherever you listen to podcasts so you don't miss that one episode that holds the answer you've been searching for. And if you feel inspired, we would love you to rate and review us so that we have the opportunity to reach more people. And of course, you can follow us on Instagram for some behind-the-scenes fun and more inspiration at @HealDocumentary and @KellyGorris. Thank you so much, and be well.